Uh, our topic is antihyperlipidemic drugs. As you can see that there is a cholesterol, phospholipid, triglyceride. They have structure formula, and phospholipid have different structure formula. Triglyceride different structure formula, and there is another structure formula. Sorry, triglyceride have different structure formula. Now we can talk about the migratory. A wild bird can fly 60 or by keeping speed 40 km per hour without stopping and overcome to 2400 km above the ocean. In this time, they will lose 66% of their fat. Thanks to burn fat, they can supply them with their water and energy. Triglyceride plus water but oxygen, they convert into nitrogen, hydrogen plus nitrogen, carbon. And the camel uses the fat for energy and water, and hump becomes small and soft. Triglyceride plus oxygen that convert to hydrogen and carbon dioxide. Basic characteristics of lipoprotein. Types of lipoprotein is chylomicrons. Another one, their density is about 0.95. Primary component dietary triglyceride 90% and cholesterol, and diameter is 75 to 1200. Other one is very low density lipoprotein VLDL. Their density 0.15 to 1.06. The primary component endogenous triglycerols and cholesterol, and their diameter is about 30 to 80. Other one is low density lipoprotein, their LDL. Their density is 1.019 to 1.063, and their primary component is cholesterol, and their diameter 18 to 25. Other one is a high density lipoprotein. Their density is 1.068 to 1.210, and their primary component phospholipid protein, and their diameter 5 to 12. In this way, you can say the water plus 4 Celsius, that their density is 1000 per centimeter, and 1 gram is equal to 1 millimeter. As you can see that in our small intestine we have glycomicrons, LDL cholesterol, and in our heart we can see that we have glycomicrons, HDL, natural cholesterol that go from blood to our heart, and then also this blood go into our artery, small intestine. Types of antihyperlipidemic drugs: HMG, acetyl-CoA reductase inhibitor, that is stains 3-hydroxy 3-methyl galactose coenzyme, miscellaneous antihyperlipidemic drugs, fibric acid derivatives or fibrates, bile acid sequestrates, cholesterol absorption inhibitor, protein. Sixth one is protein convertase, sublatism, and type inhibitor. The other one is strain mechanism of action. In this, you can see that we have a heart. In this, you can see the heart have LDL and VLDL, and acetyl convert into acetyl CoA, and that is H2. They have OH bond with oxygen double bond, and their oxygen have a hydroxyl bond to 2. That is known as mevalonic acid, and sequeline and cholesterol. Names that we can use are for statins are Lipitor internal dose is 10, 20, 40, 80 mg, and half-life is 14 hours. And Altoprevi, their internal dose is 20, 40 mg, and half-life 2 to 5 hours. And Paravacol, internal dose is 20, 40, 60 mg, and their half-life 1.8 hours. Or Zocor have internal dose is 5, 10, 40, 80 mg, and half-life is 2 hours. Their side effect is headache, dizziness, feeling unusually tired or physically weak, digestive system problems such as constipation, diarrhea, indigestion or farting, muscle pain, or low blood platelet count. Now you can see the mechanism of action. High doses of neakin available via prescription can cause severe skin flushing combined with dizziness, rapid heartbeat, itching, nausea, vomiting, abdominal pain, diarrhea, gout, liver damage. Next one is the disease name for miscellaneous antihyperglycemic drugs are Nicotine, brand name in Nesapane. Their internal dose is 500 mg and half-life is 25 to 45 minutes. And proximal proliferator activity receptor alpha, that is lipoprotein LP. Mechanism of action is lipid or trichode. Side effect: indigestion, heartburn, stomach, abdominal pain, arterial fibrillation, diarrhea, fatigue, nausea, vomiting, or sedema. And a name for fabric acid derivative fibrates are lipoid and trichar. Internal doses are for lipid is 600 mg tab and trichar for 160 mg tab, and trichar lipoid half-life is 20 hours and trichar half-life is 20 hours too. And mechanism of action: cholestyramine, closalvum, or closlipid. Their side effects: constipation, stomach, abdominal pain, gas, nausea, and vomiting. And bilicid restricting drugs are cholestyramine, clocivilium, or clostripol. Their internal doses for cholestyramine are 4 gram powder, and their half-life is 1 hour. Or clobacillum, their internal dose is 6 to 5 mg tab, 3.75 packet powder, and their half-life is 4 hours. For clostripol, their internal dose is granules, packet 5 gram, or half-life is 3 hours. Side effect mechanism of action for azithromycin: identified side effect: diarrhea, back pain, stomach or abdominal pain, numbness or tingly feeling, quiet feeling, headache, dizziness, and depressed mood. Name for cholesterol absorption inhibitor are azithromycin, brand name Zetia. Their internal dose is 10 mg and half-life is around 22. And mechanism of action for protein conversion: sublism type inhibitor. In this you can say there is no side effect there. And they have inhibitor PCKS9 inhibitor are paralow, and their parental dose is 75 150 mg per ml. Half-life is 70 to 20 days. Or evolocubam, there is a parental dose is 140 mg per ml, 20 mg 3.5 ml, or their half-life 11 to 17 days. Side effects of omega-3 include unpleasant taste, bad breath, bad smelling, sweat, headache, and gastrointestinal symptoms such as heartburn, nausea, diarrhea, severe. Large studies have linked higher blood level of long-chain omega-3s with higher risk of prostate cancer. And now we can see that we have a patient and they live in Minas Street. What is the prescription? So we have RP about Gamophobia 600 mg tab. This is example for we can do for prescription.